Hi, I'm Dr. Sachin Patel from Aged Care GP. Today I just want to share with you why coronavirus is making the headlines and what you need to know about it, especially if you're working in aged care. This information will be vital. Going to be a few numbers, won't take too long, and after this I think you'll go away with a very clear idea why it's really important to you as a fellow health professional to know about this. So the first numbers that you need to know about are the estimates that the very clever people are making, are showing that between 40 to 80% of the population in Australia is likely to experience coronavirus as an illness at some point during this outbreak. Now, one thing that we have to say is you don't need to panic. This is all about being prepared. 80% of people will have mild flu-like illness that will just get better itself without needing any other help. But there are some important numbers you need to know about, and we'll look at those here. So first of all, we're going to talk about infection rates, like what percentage of the population gets infected. We know the population of Australia is 25 million-ish. We know that I said 80% of people get better without help, 20% need help, hospital help. And in Australia, we currently have 65,000-ish public beds and an extra 30-ish private beds. So say 90 to 100,000 hospital beds altogether in Australia. And critical care or intensive care, the numbers I could find was in 2010, there were about 2,000-ish beds in Australia. That's probably gone up a bit. Maybe there's 3,000 by now, but that's where we're sitting. So remember, the lower part of the estimate from the clever people was 40% and the higher estimate 80%. So if 20% of people get infected, that will mean 5 million people will get coronavirus. But it means that 1 million of them will need some form of hospital treatment. And of those that get infected, about 200,000 people will need some form of critical care. So you can see that there's a big gap between the number of beds available and the number of people that might get infected, considering most of the beds are already busy with other sick people or with other illnesses right now. And 200,000 would need some form of critical care, and we know there's 2,000 or 3,000 beds for critical care right now. If 40% get infected, then we're talking about 10 million will suffer with coronavirus, of which 8 million will get better with no issue at all. 2 million will need some help through hospital, and again there's a big gap between the number of beds currently available and the number of sick people. Obviously it's not going to all happen at one time, and the game at the moment is to try and delay the illness, to try and spread out the illnesses so that the hospital system can help people better. And like I said, 40% would lead to 400,000 people needing some form of critical care, which again is quite significantly above the resources that are available at one time right now. Now, if we get to 60%, which is between the range of 40 and 80, then you're talking 15 million people are likely to be infected, of which up to 3 million will need some form of hospital help, which again is a gap between what's available and what will be required. And of those, 600,000 may need some form of critical care. And again, there's a big gap there. So the message here is just to help you understand why people are taking it so seriously and why you're seeing so much action being taken about it right now. The consensus is that it's too late to stop the spread, and so all the actions being taken at the moment are designed to delay the spread. And that's really important because instead of getting a big peak like this, which puts more pressure on the hospitals, the aim is to draw out the illness over a longer time so that the hospital side of things can cope a bit better with helping people like you or I who may struggle with the illness. So the important messages here are really to understand why coronavirus is being considered such a big thing, that the vast majority of people will be better without any difficulty, but a significant amount of pressure is going to come on the hospital system. And so now you know that, the next steps you need to know are what you can do to try and reduce the spread or delay the spread of coronavirus and protect yourself. And so the next video will provide that information. In the meantime, just if you're watching this on YouTube, just click and follow or subscribe to our page. If you're watching it on Facebook, just like our page so you know when new content comes out. It's been a pleasure sharing this with you. If you know anyone that this might be useful for to understand the coronavirus, then please just share this freely. Our aim is to educate and help each other so that we can all work through this together and come out the other side healthy and out the people we look after doing well as well. It's been a pleasure sharing this with you. I'm Sachin. Bye-bye.